goes.
Sounds good. Sounds
All
good.
right. Thank you so much for speaking menopause with me today. It's one way to see one another.
Yeah.
Book an interview, right?
Yeah, absolutely.
Okay, so for those of you tuning in, it is my pleasure to introduce you to Dr. Kathleen Mahannah and or Dr. Kat, as many of my friends and family refer to you as. So I love that I get to publicly thank you for taking care of many of the people that I love.
Oh, it's my pleasure. You've got great people all around you, so I'm happy to contribute in any way I can.
That's true. That's true. Okay, do you remember? I don't even know how many years ago it was, but we did a session. It was a mother-daughter session, and we
Yeah.
talked about all the P words.
Yes. Yeah.
And I can't even remember at the time, so it's okay for me to share this. My daughter Kira was diagnosed with PCOS, polycystic ovarian syndrome. And then since that time, I've been getting really curious with, well, certainly a couple people close to me, but also members of the Menopause Chicks community who may have a history of irregular periods, maybe difficulty conceiving. And I'm like, is there any chance that a diagnosis of PCOS was missed for you too? I'm wondering if we can like talk about that and then any of the other P words that you want to chime in on as well.
Yeah, absolutely. I mean, yes, PCOS has gone undiagnosed in many women and many of my patients. And, why does this matter? Well, PCOS, for those who have been diagnosed with PCOS, many are told just go on the birth control pill and that will regulate your periods. Or some are told, lose some weight and that will help with periods. And, those are often frustrating things to hear. And PCOS, yes, it does impact our hormones. It can, in some cases, impact our ability to conceive or create more challenges or barriers in that area. But it also impacts cholesterol and blood sugar and risk of diabetes. And, when my patients come in with a diagnosis, we're talking about those things actively. How do we optimize nutrition? How else do we want to think about your health in order to take care of the PCOS, not just the birth control pill or whatever other medication they may have been given? Those medications are helpful. I'm not saying they're not helpful, but it's not the entire picture. And so fast forward to, perimenopause or menopause, if women have gone undiagnosed for all these years, and we start seeing signs of prediabetes or diabetes, well, now we're playing a bit of catch up to address these pieces. So this is to say that if we know about PCOS at an earlier age, we can take action in these areas of health sooner. It's never too late, but a lot of my menopause patients feel frustrated that they didn't understand this about their hormones much sooner.
Right. So they feel frustrated. Is there anything that like does PCOS end when we stop ovulating?
That's a good question. I mean, it we don't have the same types of challenges. So, polycystic ovarian syndrome it certainly impacts hormones in the ovaries, but also insulin regulation. So, yes, we may no longer be thinking or worrying about how often your period is coming, but we're still thinking about insulin regulation and blood sugar regulation, or cholesterol levels. Also, risk of heart disease. Women with a history of PCOS may be at a higher risk of heart disease. So these are the types of things we're now really focused a lot more on post-menopause.
Yes.
Also, PCOS, if it's been undiagnosed and if women have had years of very irregular and sporadic periods, I mean, that can also impact the health of the uterine lining and it can increase the risk
Ah,
of endometrial cancer late in life. So, it's typically rare for it to go that miss, but these are things that we want to be thinking about. So, I mean, it ends, yeah, we're no longer worried or thinking about fertility. We're not thinking about inducing those very regular cycles, but we're thinking about cardiovascular health and metabolic health still.
yes, yes. Okay. We should probably clarify what are the symptoms of polycystic ovarian syndrome?
Yeah. So PCOS is a collection of symptoms. So typically it's irregular periods, meaning skipping periods. They're coming every 2, 3, 4, 5, 6 months, or sometimes no periods at all. and elevated testosterone on a blood test, and or signs of elevated testosterone. So that can present as acne or unwanted hair growth on the face or chest or belly area. We call that hirsutism. So those are the three signs we're looking at. Of course, we can also do a pelvic ultrasound, and sometimes we actually see polycystic ovaries.
Right.
So if we have, at least two of those check marks for those symptoms, that can meet the criteria for PCOS. You don't necessarily have to have polycystic looking ovaries. That's a bit of a misunderstanding. If you have, if you check the box for the other symptoms, then that would meet the diagnosis of PCOS.
I'm glad that you mentioned acne because acne does come up in the menopause chicks community quite frequently. And it gets, I'm going to say, even we're guilty of dismissing it of, oh, it's hormonal acne, or I haven't had acne since I was a teenager and now I do in perimenopause. Could you speak to that?
Mm-hmm. Yeah. So acne, uh, yeah, is it related to PCOS? Is it, another type of hormonal acne? It can be hard to tell, but this is where a blood test for testosterone is going to be useful. If testosterone is elevated, then we're looking more down that direction of, is this PCOS? What other signs are we looking for? In other cases, we might see normal testosterone levels, no other signs of PCOS. And then we're kind of looking at, okay, how do we manage acne in this case? Now, it's tricky because, of course, in perimenopause, we have irregular sporadic periods. That's the nature of perimenopause. Plus, we can have acne. So this is where we're also looking historically. So as a teenager in your 20s and your 30s, what did your menstrual cycle look like? Was it irregular? Was it erratic back then? But sometimes it's complicated. Folks who are on the Mirena IUD or other forms of contraception, they just have no idea what their periods have like, understandably. So again, this is where the testing or that pelvic ultrasound might come in handy to further understand whether PCOS might be at play here.
Yes. And now I'm going to jump to like treatment options
Mm.
because the folks that I know who two suspected and my daughter are thriving.
Yeah, that's
Isn't
great.
that great?
Yeah, it's so awesome to
So
hear.
for anyone listening, it's like there are treatment options available, and like you said, it's never too late.
Yeah. And the thing is also is that PCOS really presents on a very wide spectrum. Like some women have such mild symptoms and that's a reason why it might go undiagnosed for years and years. And other women or other folks have very obvious textbook, so to speak, signs. So every person is going to be slightly different in how that presents. We also have, the kind of classic presentation of PCOS may also involve, again, diabetes, prediabetes, insulin resistance, and other PCOS folks are very lean, and we don't see any of those signs whatsoever. So this is to say that any treatment should be tailored to the individual and the symptoms they're experiencing. So if a person is experiencing really, really bothersome acne, well, yes, we've got lots that we can do to support that, ranging from topical prescriptions or topical over-the-counter options to oral options to, as a naturopathic doctor, I'm looking in the realm of like herbs and supplements and nutrition and how we can use those tools for helping to quote unquote regulate the menstrual cycle. Again, it depends on the person. We could certainly use the birth control pill, and some people prefer that, and some people that's a really important tool. Other people prefer not to, in which case we're looking at, again, other options for helping to regulate the menstrual cycle. And again, that a portion of that should involve how do we optimize nutrition and exercise and lifestyle, but also maybe herbs or supplements, or maybe it's micronized progesterone therapy or other medical tools to help to support the menstrual cycle. So yes, everyone should know there's again, very wide variety of treatments to consider in the realm of PCOS. And I guess I'll mention a few, like one supplement in particular, and that's inositol. So
Oh,
very well researched supplement for polycystic ovarian syndrome. It helps with insulin regulation and insulin communication in the ovaries. So that can help to regulate the cycle. It can help with acne in some people. So that's a key one that folks with PCOS are deficient in. So supplementing can be
mm.
helpful. in that case. So again, a little sampling of options, but there's lots that we can do to support PCOS.
Amazing. Okay, so you've mentioned diabetes and pre-diabetes a couple of times. So underneath the umbrella of perimenopause or the menopause transition, maybe not someone who has polycystic ovarian syndrome, what do we need to know about, our insulin, preventing diabetes ultimately?
Yeah. So as hormones start to shift and change in perimenopause, we do see a slight impact on blood sugar behavior. So we can become slightly moving towards insulin resistant in some cases. And due to genetics, lifestyle, nutrition habits, some women might be more prone to go down that pathway towards prediabetes. So it's, of course, a simple starting point is a basic blood test that you could get done with your family doctor, just looking at your fasting glucose and your hemoglobin A1C. Easy starting point. I would love for all women to be getting that done once a year just to check in on that. And if we start to see a progression, in a direction we don't like, then we can intervene on that early. This is also a really good time to be thinking about or getting support for the nutrition routine. So, metabolism does start to change in perimenopause. And so this is a good time to think about how do I want to optimize or adjust my nutrition to support hormones in perimenopause. So, for example, things like making sure we're getting enough protein, making sure we're getting adequate fiber. A lot of women are surprised to learn that they're often deficient or low in both of those very important categories. And simply optimizing those two categories is excellent for supporting blood sugar regulation. And then the other category that, of course, I like to focus on is exercise and movement. This is one of the most helpful things you can be doing to support blood sugar and metabolic health. So, thinking about how to just move more, get more steps on a daily basis, and also resistance training, building muscle. The more we can invest our time and energy in building muscle now, the more supportive that's going to be for supporting blood sugar and metabolic function for years and decades to come. So those are, again, some of those key areas to start thinking about at this stage.
That's amazing, amazing. We didn't mention, but you are a Menopause Society certified practitioner and a naturopathic doctor. And one of the P words is postmenopause.
Mm.
So somebody coming to you who's already stopped ovulating, gone 12 consecutive period-free months, what are some of the things on our checklist that we should be considering?
Oh, lots of things. Yeah, this is a great time to have a little check-in. Navigating through those perimenopause years is kind of this new state postmenopause. So, of course, if there are any lingering, postmenopause symptoms that we want to address, absolutely, let's talk about those first and foremost. Are there any hot flashes, any vaginal dryness? How's the mood and mental health feeling? Energy levels? If there hasn't been any basic blood work in the past year, let's take a look at that. Let's look at, again, blood sugar, cholesterol levels,
Mhm.
those metabolic markers, vitamin D status. So basic blood work to start. And then some of the things that I've mentioned already, let's have a check-in on the nutrition routine and the exercise. How do we optimize those areas for metabolic function at this point? Having a discussion about hormone therapy, if that hasn't happened already, with every single person, whether or not they choose to go on hormone therapy, there should at minimum be a thorough discussion about that for that unique individual, given their needs and medical history and family medical history. So that's a whole visit unto itself to navigate that discussion. What else? So yeah, blood work, hormone therapy discussion, and then thinking about, our future health. So what's going on in cardiovascular health? Do we want to do any testing in that area? What's the bone density piece looking like? Do we want to think about a bone density test sooner rather than later, given family history, mood and mental health? Again, just a few pieces to start looking at.
For sure. Do you think that we're getting better at, and when I say we, I mean society, because there's a lot of conversations about menopause right now, but I'm curious what you think. Are we getting better at connecting the dots between all of the messages, marketing, media, and otherwise around menopause and our cardiovascular health and the impacts to our bone health and genital urinary health? Because I know when I started, right? I was in that place of sleep deprivation and mood changes and, and I hadn't yet connected the dots
Mhm.
to, the health of our main systems for the next 4 to 5 decades.
Yeah. I think I think we're getting better. And I think a big piece of that is women are more informed. And that's thanks to, people like you. There's more information, right? So much more often. Like this has been a big shift, surely, in the past like 5, 6 years. Is like women are coming in and they know a fair amount about hormone therapy, or at minimum, they know to be asking about it, or like asking what should I be thinking about to take care of my health, or what testing should I consider at this point? So that's a big shift.
Music to my ears.
Yeah, no, it's huge because previously, I'll tell you, 5, 6 years ago, I used to have to like beg women to go on hormone therapy. Really going to benefit from this. And now women are like, yep, I've done lots of research and I review my checklist with them. They're like, yep, 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 I know this already. And I'm like, great, awesome. So I think there's a big piece that is being driven by women. They're learning more, they've got more resources. There is the small flip side of this where, again, in the social media world, the online world, there's also so much like marketing and products and things. So there's also navigating that piece, and that's challenging, right? So that's where I think it's helpful to have your trusted, menopause society certified practitioner to help you navigate, is this going to work? Should I use this? Should I use that? Because frankly, there are some things that I read about and see online that I'm like, this is mostly marketing. And this is, unfortunately, that happens, right? When there's a need. So I think women are asking the right questions and looking in the right areas for support and having those discussions with their family doctor. And if, seeking other support or additional support where needed.
That's amazing. I like your perspective on that. And I particularly like that, we have this network of
Mhm.
practitioners who are focusing on menopause, postmenopause care for half the population, because there's a significant percentage of women still coming through who missed that conversation, who missed that education, unfortunately. Or maybe they have a complex health situation that requires working with an extended health team.
Definitely. Yeah.
And I'm thinking somebody who has maybe had a blood clot, a history of blood clots, or maybe who has breast cancer, in their family. And it's nice to be able to sit down with
Mhm.
someone who has already worked through those complex cases and helped us sort out benefits, cons, next best steps.
Exactly. And it takes time, right?
Right.
It takes time with a practitioner to navigate that in detail and review the research and have a discussion and be informed of the facts around that and have a discussion about how does that land? Like, what is your risk tolerance? How, review all those options. If we are going to do a treatment, how are we going to monitor you along the way? So there's a lot of nuance and, tailored care that goes into those more complex cases, as they should, right? As it should
As they
be,
should.
the more that we can collaborate, I think, between professionals. And, I do, some like letter writing to patient specialists and communicating, here's our plan, here's what we've discussed, and, here's what the patient has decided on. So, yeah, I think the more we can see more of that out there between professionals, I think the better that's going to be for women's health overall.
100%. And that really gets me excited because I think about the number of people that have reported, and it's always, I get it secondhand, but I had a oophorectomy when I was 46. I'm now 66.
Mhm.
And I was told that hormone therapy was off the table. I would well, at least I aspire to a world where somebody has had that thorough
Yeah.
conversation. If they choose not to take menopause hormone therapy, but they choose something else, it's an informed decision
Yeah.
rather than no decision.
Exactly. Yeah, exactly. It's been a collaboration between a professional, her care team, and the individual, right? Yeah,
Yeah,
I totally agree.
amazing. Oh, I like imagining the future with you. This is
Yeah,
great.
Yeah. Well, we're moving towards it. Again, it's been like massive shifts, I think, in the last few years in particular. And it's very exciting. And I'm really, excited to be here and so grateful to, again, people like yourself for providing this education to the public. It's so important. And women are so good at like finding information and like working together and sharing information. And I think that's so important and helpful. So yeah.
Totally. And right back at you. Thank you for the work that you do. Please tell everyone how they can find you.
Yeah. So you can find me on through my website, drkathleenmahannah.com, or on Instagram, dr.catmahannah. Those would be the best places to find me. And yeah, that's where you can find me.
Final thoughts. What's one message that you would love to give to every menopause chick today?
Oh my goodness. Just to leave everyone with there's always options, there's always treatments, there's always support. So if there's one avenue that you've tried and it didn't quite work the way that you'd hope, look for more answers and more support in another area. There's always so much that we can do to support women at this stage, and that's a exciting place that I love to work. So yeah.
Yes, that is beautiful and exciting and inspiring. Thank you so much for speaking menopause with us today.
Thank you so much, Shirley. Thanks for having me.
Take care.